Award, Global Asian Award, Excellence in Women Care, CSR Times Award, CSR Impact Award for Divakar's Service Trust. She has sent her video presentation. Let's all listen to it. Because of flight cancellations.
Namaskar. That's me whom you see in the picture, wondering what I should be talking about. Well, when Manisha and the organizers contacted me, we discussed that we should speak something about women's health is nation's wealth, and what are the problems that are still acting as a huge barrier for us to reach out to the last mile, reaching every girl, every woman, every time that she needs our help and care. Well, today the focus is on solutions, because anyone who wants to make an impact, rethink and realign how we could leapfrog and figure out the solutions for ourselves in countries like India, who are rightly being recognized as a role model for rest of the low middle income countries. So let me spin this topic around to the femtech revolution which is in the making, as the technology is percolating into every nook and corner of our country, and how some of these technological and wearable devices and digital innovations help us in our vision and mission of reaching every girl, every woman. They have the potential really to revolutionize the maternal health care by offering continuous monitoring to promote remote access, managing maternal stress, and facilitating detection of early complications. When we had a survey in one of the OBGYN meetings in the recent past and asked, have you heard of the word called femtech? By catalyzing the use of digital platforms to empower them and truly say that we have devised only OMSP, that is to ensure wellness, prevent illness and promote wellness is the mantra, and we should not be doing it in a fragmented manner, that is doing history. And there is a problem that you detect there and quickly fix it and develop. No, that's at every point across her life course, and that is what this wheel is trying to show us. Empower her, educate her, give her the access through technology, and no matter what problem she comes for, tie up all the loose ends, connect the dots, and help her be prepared for the next phase of her life. In this context also, the future of healthcare of women in India is being transformed by the use of digital technology. As you can see, we've always been concerned about the access to care, the affordability and quality of care. If these many women line up for a doctor in her outpatient, who is the sole person there having to check on all these and also attend to the emergencies and finish the sessions on time, you would see how challenging it would be, and the ratios of the numbers required of the healthcare professionals to those who require care, it's very, very obvious, and I say the pictures speak for themselves. What is the way out? Is there an enabling environment in the country? We would say a big yes, because there are millions of mobile users, and you see right across the pregnancy topping the list, fertility issues being the next, and many of the long-term problems. Everybody is using the technology in the best possible way, though it's limited at the moment and has a scope for scale up. This is the way where what we thought was not possible could be made possible. And do not underestimate our women in the rural areas. You would see that every segment, every sector is quite savvy with the technology, and it is the COVID which made the doctor community rush towards the use. But as you can see in the picture here, the next generation, needless to say, will be hooked on to the use and the ease of technology to remain well. The wearables may offer a greater convenience as they reduce the time for the patients to invest in booking the appointments with the healthcare professionals, traffic jams, long distance travel, and the loss of wages in some rural community if they have to come to a city center for their care, and the time and money needed for this is really what is making the healthcare cost effective and quality driven. The digital India is a new India, and once again I would like to emphasize that it is the healthcare community which has a mindset block somewhat, and we have not explored the use of this to the best that it can be. How is it that the wearable usage and the community connect has been possible through technology? Well, we have walked the talk because we have established the rural community health centers where these Swasthya Sakhis or the wellness ambassadors learn to use a glucometer, learn to use a chemocube, a weighing machine, a digital BP apparatus, the pulse oximeter and the digital thermometer, and most things that any healthcare provider can manage is managed by the community health worker themselves. This is a huge advantage to the local village girls and the women, and if they need to, they will then flag the concerns to the healthcare specialist through the video consultations, who is sitting far away in the metro but will be wise enough to offer the care that is required. The new era of pregnancy tools, whether it be for fertility tracking, hormone monitoring, nutrition guidance, mental health support, educating and building awareness for early detection of problems, everything is right available there. The nutrition and the lifestyle is defined as a major foundation of many NCDs which are emerging. We have millions of women who are obese right from their childhood, have several menstrual problems, and are shrouded with issues like the polycystic ovarian disease, for example, and they move on with the issues related to conception because of the problems of obesity. Well then, nutrition and supplements of micronutrients, the burden of obesity swinging on to undernutrition and malnutrition, everything is a spectrum which the clinicians fail to address in an appropriate manner. Even the dietitian luxury is not available at every setup, but the nutrition checklist, which is bought in by our international organization, a simple checklist with 4 or 5 points, and it should be embedded in the standard of care for every girl and every woman to sensitize them to where are the gaps and to sensitize us to the specific advice that we need to be giving. But the ground realities in the paper that we produce brings to light that if you actually use the checklist, it's very easy to use. Before the use of checklist, were they taking the dietary history, the dietary recall, was nutrition given the due importance? And the answer is clearly sometimes yes, sometimes no, but not very sure, and it just takes less than 5 minutes to administer this checklist. But then what next? Then you can always guide them to the standard nutrition apps with plenty of recipes whereby she understands which food group is important for her and for what purpose. So almost all the respondents agreed that the information gathered through this checklist can help the women throughout their life course in guiding them to this important aspect of nutrition. Transforming the women's healthcare to the femtech is repeatedly a buzz that's being created in our circles, making the therapies more efficient, especially in the private practice settings. Mental health is emerging as one of the forerunner of many in their life course, and Femtech is here again playing a pivotal role in providing accessible, personalized and stigma-free support for any girl, any woman in any remote corner. We are creating a cadre of mental health counselors who have the ability and the patience to listen to the problems, which is the first big step in relieving the stress, and secondly, guiding them through simple tips and flagging off where necessary to a bunch of psychological counselors or further on to the psychiatrist where necessary. The maternal stress management, as you can well imagine, the escalating IVF pregnancies and infertilities and elderly age group who gets pregnant, there is a lot of stress beyond the joys of motherhood, and monitoring the stress levels through wearable devices also is an important and impressive method to solve this problem. Innovative management of pregnancy is slowly coming into the mainstream of the OBGYN's practice. The pre-pregnancy and post-pregnancy care, which complete the spectrum before and beyond pregnancy, with a large part of these devices being used during the pregnancy. So we said some delicate questions like the domestic violence, the history of alcohol or smoking intake, etc., which form a part and parcel of the high-risk pregnancy care in the aspect of history taking, also the immunization status, and needless to say that many odd questions regarding their basic health, the medical and surgical problems that they have had before, they can actually self-administer and answer them even before stepping into the consulting chamber. The point of care devices are a great boon because anyone and everyone can use it just about anywhere, and fancy laboratories are not required. Hemoglobin used by the HemoQ is already approved by the government and is done in all the camp settings for the Anemia Mukta Bharat initiative. And during pregnancy, you'll see a number of devices that could be connected for the centralized monitoring, especially the Baby Beat, which is by the care mother. It is a handheld, small, wireless equipment to get the heartbeat tracings of the fetus, which is needed in the frequency about twice a week in high-risk pregnancies, in pregnancies with gestational diabetes, in pregnancies with hypertensive disorders, and all of these where even the movements are less as reported by the patient. We rent this device in the last 4 weeks of her pregnancy. The patient can easily do this test at home, and by the Bluetooth, the CTG graph comes on to the mobile of the consultants, and if everything is good, we give her a thumbs up, or if something is suspicious or we are not happy with the report, then we immediately call the patient to the setup. This avoids many unnecessary visits and it ensures a close monitoring as per the required frequency. The literature also supports the remote fetal monitoring, which reduces the neonatal anesthesia and the healthcare costs with the routine remote monitoring, which is brought into practice in many centers pan India. So therefore we say the future is now. These are not some fancy equipments which are not available. They are within a reasonable cost, and especially the rental model works very well with our patients. And as you see, the number of devices which can be used remotely, which can convey the necessary information to us, would actually reduce the 10 antenatal visits to only 4 visits. The rest of it, the contacts are there through the digital platform, and everything that needs to be done is done in a much better way. Wearables act as an additional layer of vigilance, complementing the traditional prenatal care and enhancing the overall quality of the maternal care. There are some devices that can be hooked on to the baby as well, treated into baby's clothing and attached directly to the infants, offering a continuous stream of the parameters which we need to keep a watch on. The femtech applications to guide and support the mothers for the breastfeeding, the postpartum recovery, inclusive of the mental health, which is becoming a huge challenge, the postpartum blues, depression, and harming herself and beyond. So the family needs the counseling for this. We do not have enough number of physical centers.
Thank you, ma'am, for the excellent session, and we are going out of time for the session.